So good afternoon, Dato Ali. So today is my pleasure to interview Dato Dr. Muhammad Ali. He's a consultant nuclear medicine physician. And today is I would like to welcome you to our interview, Dato. So the objective.
Thank you very much, Mr. Ng.
So the objective for this interview is actually Dato Ali has kindly sponsored the Dato Dr. Muhammad Ali Khader's Outstanding Award for Nuclear Medicine Technologies and Nurses. And these two awards is actually to recognize a nuclear medicine technologist, radiographer, or nurses who has a distinguished and outstanding service contribution for the benefit and advancement of the nuclear medicine services. So thank you very much, Dato, for your kindness. So without further ado, let's know more about Dato. Dato, would you mind to tell me more about yourself?
Right, okay, very briefly, a little bit about myself. I grew up in Johor Bahru and is an alumni of the Science Secondary School of Selangor. I qualified in the field and subsequently obtained my postgraduate radiology qualification from the Royal College of Radiologists in London in 1990, and subsequently did my subspecialization under the IAEA Fellowship Training Program in the field of nuclear medicine. I'm happily married for the past 40 years to Dr. Siti Khatijah Hamdan, a consultant pediatrician, and I'm blessed with 4 children and 2 granddaughters. I've served with the Ministry of Health Malaysia, mainly based in Penang Hospital, with a 7 years secondment to the School of Medicine, University Science of Malaysia in Kubang Keren, Kelantan. I've retired from the government service in 2015 after serving for 32 years, and my last post with the government was Head of Department of Nuclear Medicine, Penang Hospital, and the National Head of Nuclear Medicine Services in the Ministry of Health Malaysia. I now work as a nuclear medicine consultant for the PET-CT Center in Mahkota Hospital Melaka on every Mondays, Tuesdays, and Wednesdays, and at the Mount Miriam Cancer Hospital, Penang, every Thursday, and is also a visiting consultant to the Nuclear Medicine Department, Hospital of the Presidential Affairs Administration, Republic of Pakistan. Kazakhstan.
Thank you. I think that's I'm glad and very pleased you have that have a very excellent career and also as happy family. So that's very good. So Dato, I think I've known you since I was working in the Ministry of Health, I think for the past 15 years. So we worked together in a few projects, namely like quality assurance programs, quanomes, as well as distant assisted learning for nuclear medicine technologies. I can see that you are very supportive and very outgoing to support all this development in the nuclear medicine field. So Dato, what makes you choose to become a nuclear medicine physician? And briefly, can you share with us the development of the nuclear medicine services in Malaysia?
Sure, I'm very happy to share with you. Well, during my radiology training in England in 1987, I attended the nuclear medicine classes every week as part of the radiology training. And it was then that I realized that nuclear medicine was not just purely a field of imaging, but it also involved therapeutic work. This spurred my interest in nuclear medicine, and I pursued further my training in nuclear medicine under the fellowship program of IAEA at Guy's Hospital London for adult nuclear medicine, Westmead Hospital Sydney for pediatric nuclear medicine, and the Peter MacCallum Cancer Centre in Melbourne for the PET-CT scan services, and also in Brescia, Italy for the therapeutic nuclear medicine. The training in the various centres, Mr. Ng, has greatly helped me to become an all-rounder nuclear medicine physician. Though nuclear medicine in Malaysia started in the early 1960s, this field was not yet established to its fullest potential, and the services are very limited to certain centres. This gave me the inspiration to develop and expand the nuclear medicine services in our country. And upon my return to Malaysia after training, I proposed the idea of expanding the services of nuclear medicine to the Director General of Health Malaysia, that's our DG, And finally, after many correspondences and meeting, he gave the green light, and of course, the rest is history, as you know.
Excellent, excellent, Dato. And this give us what we have now, Dato. So I think along the way, you have a lot of, I believe that you have come across a lot of up and down and a lot of hurdles that you have been through and a lot of happy and exciting achievement that you have seen. So Dato, what do you enjoy the most when you become a nuclear medicine physician?
Yes, I certainly agree with you. There are a lot of ups and downs, triumph and tribulation of during the development of nuclear medicine. But what I enjoyed most when I become a nuclear medicine consultant, and the most memorable events is working with a dedicated team consisting of nuclear medicine doctors, technologists, nurses, physicists, and other supporting team members to help expand the nuclear medicine services in the Penang State and also in Malaysia. Some of the milestones that I can remember fondly, which I was involved directly, are helping the Malaysian Ministry of Health, that is KKM, to expand and develop the nuclear medicine services in the country. I'm proud to say that I was instrumental in setting up the nuclear medicine division in Penang Hospital in 1994, and later to upgrade it to a department, and also the establishment of the first PET-CT services in Penang Hospital in 2000 and 2005 in Malaysia. I'm also involved when the MOH made the decision upon my recommendation that nuclear medicine should be made a specialty on its own in the Way Forward meeting for nuclear medicine in 2002. This decision actually has significantly helped the expansion of nuclear medicine services, particularly in the terms of administration, budget, staffing, infrastructure, equipment, and training. The other thing that I'm very fond of is paving the establishment of the Masters in Nuclear Medicine Postgraduate Training Program in Malaysia, conducted jointly by University Science Malaysia, that's USM, and our Ministry of Health. I'm happy that the program has successfully produced more than 50 nuclear medicine physicians to date since it started in 2008. I'm also involved with various IAA projects to help expand nuclear medicine services in our country, and also have been appointed as expert consultant for various IAA projects in Pakistan, Sri Lanka, Mauritius, Indonesia, United Arab Emirates, and also Algeria. Yeah, thank you.
Yeah, excellent. So I think there's a lot of things that you have achieved a lot. And Dato, along the way, when you're working with a lot of people, I believe that you have met from international expert until our ground people working in various field and expertise. And in your opinion, what are the roles of nuclear medicine technologies and the nurses in the nuclear medicine services? And what did you enjoy the most when you work with them?
Well, as you know, the nuclear medicine technologies, who comprises of radiographer, medical assistant, and lab technologies, and also the nuclear medicine nurses, they each have their specific roles in the department. This is clearly spelled out in their job description when they entered the department as a working member. Each of them play an important role in patient care and in the highly specialized service of nuclear medicine. And each of them play an important role in the development of nuclear medicine services, be it in the hospital, state, and also in the country.
Thank you. And this year, we are very proud, on behalf of society, we are very proud to announce the invitation of the nominations for these two awards, namely the Dato Dr. Mohamed Khader's Outstanding Service Award for Nuclear Medicine Technologies and Nurses. So, Dato, in your opinion, I remember that you approached me last year when in August during the last MyNM, we talked about your intention to sponsor this award, and in particular to give encouragement to our colleagues in particular for technologists and nurses. So can you share with us what is your motivations to work with the society to establish this award?
Well, like I said before, each of them play an important part in patient care, in the highly specialized area of nuclear medicine, and each of them play an important role in the development of the nuclear medicine services in the country, state, and also hospital. This award is actually, Mr. Ng, a small form of appreciation for them, and hopefully this will spur them and other staff members to keep the enthusiasm burning and achieve even greater heights in their service.
I totally agree with you, Dato. So I think this is very important to give support to our colleagues. So considering how the nuclear medicine field is evolving, where do you see nuclear medicine technologies and the nurses play in the next 10 to 20 years? And what is your advice to them?
Well, I won't go as far as 10 or 20 years, but maybe 5 years. The field of nuclear medicine is rapidly expanding, especially in the field of theranostic. Right? I urge the nuclear medicine technologies and the nurses to stay abreast of the latest development. Always keep on updating yourself, be proactive, and to take the lead and help their respective head of department in expanding the nuclear medicine services wherever they may be working, be it in the government sector, university, or in the private sector. I do hope that they would also contribute towards the development and expansion of the Nuclear Medicine Society and also the molecular imaging in our country. Thank you very much.
Thank you very much, Dato, for joining us in this interview. I just reiterate what you have said just now. This award is, we hope that to keep all our colleagues, the enthusiasm burning, and also to achieve to a greater height. So we have to do in a teamwork and as well as to support each other. So thank you very much, Dato, for joining me. And I wish you a good health. And thank you very much again for your kindness and generosity for sponsoring this award.
Well, it is certainly a privilege and pleasure for me to sponsor this award, and hopefully other takers will also sponsor other members of the well-established team like the physicists and other supporting staff. Thank you very much for the interview. Thank you.
Thank you, Dato. This is the end of the interview. Thank you very much. I will just end the recording.